one last look at the muscle right here. Now, what we're going to look at before, right, on the, because I'm going to switch to the other view in a second, but here's your, again, pectineus, adductor longus. Now, as we go a little bit deeper, then you see this really thick muscle right here. It goes to the linea aspera right here. This is your adductor magnus muscle. Now, in a second, I'm going to show the other view so we can see these muscles on the posterior part of our leg and the hip region. So I'm going to start with the hip. As we go to the posterior part of our hip, we're going to see that, again, right, all of these on the back side of our leg, all of them are going to be flexors of some form or another. They're going to flex the knee, they're going to flex the femur, they're going to flex your ankle. As we go further down, they're going to flex your toes. So it's kind of completely opposite of what's seen in the arm. In the arm, the anterior part, when we're in anatomical position, all those muscles in the arm are all flexors. Well, that's the opposite in the leg. All the anterior part of your leg, those are all extensors, right? In the arm, all the posterior muscles are extensors. In the legs and the hip, all the posterior muscles are flexors. So it's just kind of flipped 180 when we compare the leg and the arm. So right away we can see that the muscles of the posterior hip region is dominated by the gluteus maximus. The gluteus maximus is huge, it goes down, and it's one of those rare muscles that has most of the muscle belly or the meat of the muscle way up here. Yet when its activity is actually allowing you to take a step and push up. So we're talking about when you are walking up steps, right? When you bend real deep, when you're doing squats, those are all muscles. That is all functions of the gluteus maximus. Here's the iliotibial band coming all the way down. And then here we can see the muscles of your hamstring. Now, I don't get a chance to tell you and show you guys this, but when you get a chance, when you get a chance, what I want you to do is to look, right, and feel the back of your leg. As you feel the back of your leg, where your knee is, you should feel a real thick, 2, 3 real thick type of tendons there. Well, those tendons behind your knee, those are all tendons of your hamstring muscles. So if you feel that and you feel the lateral tendon, that is part of the muscle we call the biceps femoris muscle. So it doesn't matter where it is. Biceps allow you to flex. Biceps brachii flexes the arm, specifically the forearm joint. The biceps brachii allows you to flex your knee. And then in the middle right here, medial, you see actually two muscles, with the superficial muscle being called the semitendinosus, and then the deeper muscle, the semimembranosus. So let's go a little bit deeper, and we should be able to see that in a second. Now, if we look deeper here, I'm just going to zoom in a little bit so we can see a little bit better. I do not think these muscles are in your, they're not in your lab manual, so that's not good. But I do have pictures of it. I'm going to show it to you here, and you will have videos on the models that we have. So once we've removed the gluteus maximus, we see the next muscle, the gluteus medius right here. And I want you to memorize this based on superior to inferior. So the most superior one, that's deep, gluteus medius. Then the piriformis muscle. Then you see this huge nerve. This is the sciatic nerve right here. Now, once we remove the sciatic nerve, which hopefully we can right here, right, then you can see the muscles that are deep to the sciatic nerve. So the first one is your superior gemellus. Then this one, right here, that one right there, that's going to be your obturator internus. And then this one deep to that, or inferior to that, that's going to be your inferior gemellus. Right? And then this muscle at the very end right here, that is your quadratus femoris muscle. Again, piriformis, gluteus medius, then piriformis, then sciatic nerve. Once we remove the sciatic nerve, then we can continue. Then you can see right here, right? Superior gemellus, obturator internus, and then inferior gemellus, and then quadratus femoris right here. And now that we've removed that part, right, I'm going to go back down so then you can really see over here, semitendinosus. And then as we go a little bit deeper, down a little bit, and we've cut away the gluteus medius, we've cut away the sciatic, we've cut away the semitendinosus. Now we can see the semimembranosus right here. Now, as the actual nerve comes down, the sciatic nerve comes down, and it's going to turn into the common fibular or common peroneal nerve. Right? The common peroneal is going to wrap around the other side of your leg. Then this one continues as a posterior tibial nerve.